Hi, my name is Dr. Sylvia Cole, and I will be discussing the treatment plan for the schizophrenia spectrum disorder. Mental illness impacts an individual's ability to think clearly, function properly, and experience normal life, and relate to others. Mental illness impacts the person as well as the entire family. When a patient is seeking treatment, it is best that the entire family is involved in that person's seeks treatments as well. Um, the treating therapist's job is to ensure that they provide that they provide treatment that is best for the entire system. In order, and they need to find treatment that will best fit, that will ensure, let's see, how do I say this, that it's the treating therapist's job to ensure that they provide the necessary treatment for the entire family that will help return them to a healthy state of homeostasis. Um, um, the case study is involving Dr. Dr. Michael Wan. He's a licensed psychologist who's actually treating therapist in this case. He's an experienced clinical psychologist um, who has experience working with college students at a local university, and he provides therapy services as well as he has a private practice. And his approach is culturally informed, person centered, strength based, and recovery oriented. He'll be treating Ephraim, Ephraim is a 23-year-old single second generation Filipino male who is seeking therapy on um, who's seeking therapy um, therapy service after his family had him committed to a week-long and voluntary psych hole after he locked himself in his room for a week. Ephraim, he spoke of being paranoid about his family, monitoring him to him hearing due to hearing him speaking to himself. He has admitted to hearing voices in his head. The main voice in which he actually heard was the voice of his deceased grandmother. Um, that his grandmother voice actually guided negative thoughts away in a sense, and actually um, led him to do positive things throughout the day. Um, he said that he heard sometimes he would hear maybe 4 to 5 voices 4 to 5 times a week. Um, Sometimes more often when he would be at school or trying to do schoolwork. He reported that he heard and that he sometimes would hear even more voices when he was trying to concentrate. Um, he has been home for a couple of weeks now, and he's now trying to get back into his normal routine of things, um, which would be to go to school and to go to work. And once he left the psychiatric hospital, they actually put him on meds to try and calm down the voices, etc., and to try to get him back to to help get him back to the psychiatrist to help get him back to his normal routine. So he's been taking the medication regularly. Um, but he admitted that he's not happy with taking the medication, with the outcome of things, because he feels like he's being really monitored by his family. Um, he did admit that um, that he is really still real paranoid about the monitoring, and that he feels like his family are being judgmental, and that they're judging him negatively um, because of the voices that he hears. Um, the video um, let me know that let me know several things. Um, that Ephraim, it told me a lot about Ephraim's family. For instance, that Ephraim's system actually included his father, who was a Navy veteran, his mother, who's a nurse, and that he had an older sister who actually ran away, and that now actually she actually returned home. But his family as a whole is deeply religious, and that Ephraim stated that that made him uncomfortable, and that that he also stated that his relationship with his family was strained due to also due to um, him not being close to his father, since because his father was gone a lot, because he was deployed a lot, and his sister, that she returned again, and that his mom, his mother, from his perspective, if anything ever really happened in the home, that she kind of always took his father's side, and that he always would be wrong, even if he was right, he was wrong. He also stated that the only person that he truly had a real strong family tie to, was his grandmother. And his grandmother, she passed recently, and that's the one who he hears the voices. Um, and that his grandmother's voice actually keeps him calm and encourages him at times. He has very few friends, and he has very little support. Um, and that he does, the few friends he has comes from online gaming communities. He's never been in any romantic relationship, and he often feels very isolated, and he's had a very strict upbringing. Um, he's very guarded and soft-spoken, and he has he doesn't really know why he's even in treatment. Um, he's only there because his family feels as though he needs help. So that's pretty much why he's in treatment. He's actually in treatment. Um, his lifestyle is heavily influenced by his family and his family culture, but it's also influenced by the San Diego culture as well. Um, and that kind of conflicts with his home life. His family religious roots require him to attend church often in order to stay in his family home. And he expressed that the religious beliefs, his family religious beliefs, make him feel guilty about the voices that he hears in his head. And it makes him feel sad and ashamed. That he also said that since his grandmother has passed, that he also feels alone, and he feels like he has no one that he can relate to within the home. Um, he he has expressed some closeness to some cousins who lives in other cities, um, but there's no one in the home that he communicates with because people in the home kind of goes their separate ways. Um, the diagnosis. So after listening to everything that that I on the tape and etc. And I recognize that from everything that Ephraim stated that the hospital diagnosed him with having an episode that falls on the schizophrenia spectrum. And since there was no evidence that um, at at that time that that Ephraim had ever heard any voices prior to the passing of his grandmother, which was very, very important, that I concluded that Ephraim is probably experiencing a brief psychotic disorder with some hallucinations, which would fall under the DSM code 298.8 F23, and that would be APA 2013 reference. And Ephraim's marked stressor seems to be from grief, from the passing of his grandmother, because brief psychotic disorder is like is a sudden short-term display of psychotic sorry um, a short-term display of psychotic behavior, such as I'm so sorry, excuse me. Psychotic behaviors such as hallucinations or delusions, which occurs um, with like a stressful event and is triggered by extreme stress, such as traumatic accident or a loss of a loved one. And it's common in like people like people in their 20s through their 40s, and the reference for that is Fusar, Poli, I think you said Capuchita, and Bolini 2016. That's how you say it. I'm sorry if I didn't say it right. Um, and the disorder could last up to 6 months with effective treatment. Then the diagnosis should be reevaluated if it continues. Ephraim symptoms and his current issues are aligned with the systems and triggers with the disorder. However, although the original symptoms could someone could misinterpret it for and misdiagnose it for schizophrenia, you do have to take into consideration the fact that how do I say that his history of him not having any of these shutdowns prior to um, or prior to or hearing the voices beforehand, which is very important. So that's why I said that. And then also we have to take in consideration that when anyone loses anyone that's close to them, that's very traumatic, and it can trigger depression, or it can trigger it's very stressful and traumatic situation, and that his family as a whole should be sympathetic or empathetic to the impact that it's actually having on him, and they should understand what's happening to them. They should be more open to what's happening to him. And so his family, this is where, in my opinion, psychoeducation comes into play, and it's very essential. Is very essential in working with this population, um, because it educates it educates the family as a whole, and his family may not know the impact that this is actually having on him and his symptoms. So psychoeducation is very important here. Collaboration with Ephraim and his family would help the therapist be more effective, and increasing the knowledge. The knowledge base within the family often reduces like any expressed emotion that could be what Ephraim is experiencing with his family, um, such as like what's triggering like his paranoid behavior or whatever, and that will be hard in 1998. Um, so when we start talking about the treatment plan that I think will be most helpful when I look at this entire situation, it would be, I would choose, and if I'm wrong, that's one in class, would be EFT, emotional focus therapy. And I chose this because it will help facilitate the creation of um, secure bonds that Ephraim needs, because Ephraim lost the only person that was in his house that he was close to, and that's why I chose this, which was his grandmother. And right now he has no bonds. And so that was one of the reasons why I chose this treatment plan. And so research with the EFT, it will help facilitate the creation of secure, lasting bonds between the family members, and it will reinforce any pre-existing positive bonds with the objective of helping and assisting helping those in treatment increase security, closeness, and connection and intimate relationships. And that will be Good Therapy 2018. If Ephraim is clearly experiencing a loss that most likely the entire family could be experiencing, but we really don't know it because it really doesn't discuss that in the video. As well as they could bond them. Ephraim expressed that he feels little or no connection to anybody in the family. And that's probably why it triggered the voices of the grandmother, as well as those other quote unquote controversial voices that that he is hearing. And so it's my opinion that if we can create like new close bonds with the people that he lives with and shares culture and experiences with, that he may that he may not need those those voices. He may not need to have those voices that he has in his head anymore, and try and hold on to like his grandmother's voice, etc. It would be like getting rid of the security blanket, like in Charlie Brown. I think it was Linus or one of them that would carry around the security blanket, and he everywhere he went, the blanket went with him. So if we could create a new close bonds with the people that are actually living in the home with him and share the culture and experiences in his life, then we could get rid of it. Could we, he may not need um, the the voices. Maybe it would stop triggering the voices of his grandmother and the controversial voices that he's experiencing in his head. So below, so my thing is we could get rid of those, and so I'm going to, I figure we would do this in stages. Stage one would be I could identify the key issues of the concern. concern, which would be Ephraim's um, key concerns are the fact that the loss of his grandmother has sent him into a brief psychotic disorder, and now he's having like hallucinations due to this lack of the close relationship, i.e., now he's hearing of her voice as well as these controversial voices that he's actually created as a coping mechanism. So now what I want to do is I want to get rid of those voices, and I want to create other close relationships that would allow him to disconnect the need for the voices that he's actually hearing. So that's why he could get rid of that security blanket that he has. I want to get rid of that security blanket of those voices that he's actually created in his head. So I want to disconnect that. And by addressing the voices with his family in a culturally sensitive manner, and help them to understand that, and understanding that his culture does, because his culture does acknowledge spirits. That's one thing that they do. His culture does acknowledge spirits and other entities through dreams as real, as being real, is key to opening up the conversation about Ephraim's needs as well as the needs and concerns of the rest of the system and as of religious beliefs. And so each member should be spoken to separately. And I'm going to understand that each person's conversations will be private. And I'm going to make sure that they understand what is thought to be the key concern for each member of the system. But I'm going to make sure that I speak to Ephraim first, so that he will know that that I'm going to be speaking to each person. But that would be my step one. And step two, I'm going to identify ways negative patterns of interaction increase conflict when key issues arise. So when Ephraim is overcome with grief, he withdraws and is inundated with hallucinations that confront him, that cannot confront him, that comfort him. So the voices come when he has a lot of grief. When he's overcome with grief, the voices are coming, and to comfort him through the grief, but have negative health effects. So Ephraim is also triggered. Ephraim also triggers his father seemingly rejecting the family religious beliefs. So communication and education to both members can alleviate the negative effects of the miscommunication of Ephraim's disorder, as well as Ephraim's father's misunderstanding why Ephraim does not want to attend church. Instead of speaking to Ephraim, his family just spies on him. So to fix this, what we could do is we can have a conversation about that. And instead of them spying on him, because what that does is they need to understand that makes Ephraim withdraw. And that increases his paranoia. So if they were to state their concerns openly, that will help build a deeper level of communication. And he may actually help to build more trust, and help make him feel more safe with them. And so that will help change the pattern and help maybe to rectify the family's inability to communicate if they do that, opposed to just walking around or just spying and looking and things like that. And so when something negative happens, if the issue is not discussed and because every time when things negative happen, they don't discuss anything. What they do is they handle everything through the family hierarchy. And so without ever discussing anything, everything is handled throughout their family hierarchy. And so no one ever has a voice, ever, only the people in the family hierarchy. So we have to identify the patterns, and if identify all of these patterns and create different ways of interacting, communicating, and give everyone a voice within that family. And that's what's important. So we have to identify ways of changing that behavior and give everybody a voice and teach everybody how to communicate and communicate effectively and openly. Um, Step three, the therapist would assist in an identification of unacknowledged fears and negative emotions related to attachment, underlining negative interaction patterns. And in order to get the family to see each other's perspective, dialogue must be facilitated in order to make sure the family communicates in an effective manner. A family session where we don't say I, where only, well, not where we don't say I, where only I is used. So instead of just saying you, we don't do the you, we say this is how I feel, and we don't point the finger and say you, and opposed to placing blame on other people, we're just using only I. This is how I feel about this, and only I is allowed, and that can help each subsystem express the feelings without placing blame. And you're not allowed to use you. It's only I is used, not you. And we can do a role play, and this can say, well, this is how I feel about this, and it's only I used during this session, and not you. Only I. And that usually works effectively. I actually use that myself when I'm talking to somebody and I want to try and get something resolved. I only use I. I strictly say how I feel. And even though I'm tempted to say you sometimes, I stick to the I, and it actually works. Step 4, the therapist reframes key issues for the family in terms of negative patterns. Of interaction, underlying emotions, and fears in everyone's attachment needs. Step 4, stage 2, changing interaction patterns. And step 5, breakdown sessions, especially helpful understanding perspectives and what each person's needs in order to maintain healthy relationships. Individuals are assisted in voicing both their attachment needs and deeper emotions, speaking to each member in individually scheduled sessions to voice how their needs help the therapist to understand what will bring family to homeostasis and see the difference and similarities of their needs, which is very, very important. And that's what a lot of therapists say is the breakdown session, because it's a helpful in understanding individual perspectives and what each person needs in order to maintain healthy relationships. Step 6, family is coached in ways to express acceptance and compassion and empathy for families' attachment needs and deep emotions. And during this time, we'll do group activities, and that would include role playing as well. And during that time, we can I can have them play games, role play, and do things and to express, like in the past, how things were done in the past, and they can role play like how you did something in the past, and now you can show me how you would do this and how this took place in the past. Now, this is what it looked like in the past. Now I'm going to show you this is how it should look in the future. This is a healthy way of doing it. This is how you should handle it now. So will show this is the new healthy way to for this situation should look now. Step 7, members are coached in the expression of attachment needs and emotions while also learning ways to discuss those issues likely to cause conflict. So, role playing again, I'll have them face each other and they can hold hands, or they can just face each other and they can just sit and tell one another their needs using the I statement. I need more space. When I'm angry, I need you to leave me alone and give me some space. Or I need to feel like I have a voice. But this is when they will tell one another exactly what they need from one another, which is very important. Stage 3, consolidation and integration. Step 8, they will get coached in the use of communication styles to talk about old problems and develop new solutions. Role playing again. They'll do current situations and how they are played out currently, and then they'll role play ways the other person could have reacted where the other member would have received the message in a clearer, healthier manner. And then step 9, which is the final step. They will learn ways to use skills outside of therapy and develop a plan to make new interaction patterns that will become a consistent part of their life. So then they will get an introduction of Family Day where the family spends an hour talking about issues while doing something fun together. So those are the 9 steps. And then would I refer? I would do a referral where Ephraim would be encouraged to keep seeing a psychiatrist, which would help regulate his medication, as well as have him seek further treatment, continue with further treatment. And then I will also recommend that he does grief group counseling outside of family therapy, and that he would actually go to like a social circle and a support system, a social circle, so maybe he can meet new people. And then individual therapy would be helpful for Ephraim because then he would have maybe a safe circle to explore like the loss and the grief and the loss of his grandmother, and process things like when they arise that, outside, arise in his family or whatever. It could be a place where he could work on some of his social skills as well. So that is my conclusion. I've never done this before, but I thought I would come out my comfort zone and do something different. So thank you so much for listening, Dr. MATTA, and you have a wonderful day.